Hello, and welcome to the Simply Healthcare Plan's 2016 Medicare Advantage sales presentation. At Simply, we want to show you how you can make the most of the Medicare benefits you've earned. So today, we want to provide you with information that can help you make an informed decision and select the Simply Healthcare plan that works best for you according to your specific needs. When you enroll in a Simply Healthcare plan, we're here to help you when you need us. Medicare was designed to give you the health benefits you need and the peace of mind you deserve. Simply offers free interpreter services to assist you and answer any questions. Please see the Simply Benefit Consultant if you need any assistance. For 2015, Simply Healthcare Plans received an overall 4-star rating from Medicare. The consultant presenting the information to you is either employed by or contracted with Simply Healthcare Plans. He or she might be compensated based on your enrollment in a Simply Healthcare plan. After you sign up, your Simply Benefit Consultant is available to you, meaning that he or she will be happy to assist you with any questions or concerns, and that gives you added peace of mind. Here's what we will accomplish today. We'll be going over who we are, your eligibility, and your Medicare coverage options. We will also help you decide the best plan for you, how and when to enroll, and provide you with Simply's contact information. Formed in December 2009, Simply Healthcare Plans is a Florida-licensed health maintenance organization established to meet the needs of Florida's diverse Medicare population. Simply's mission is to simplify the healthcare experience for its members and providers. The plan is anchored by its core values of service and respect. Just look at all the counties we're in for 2016: Miami-Dade, Polk, Osceola, Orange, and Seminole. But for those of you who like to travel, we also provide worldwide emergency care coverage. With Simply, you will receive the benefits you currently have with Original Medicare, plus much more, and may include low or no monthly plan premiums in most areas, Part B premium reduction plans in Miami-Dade only, personal emergency response system, maximum out-of-pocket protection, brand name and generic prescription drug coverage, dental, hearing, vision, gym membership, transportation, over-the-counter benefits. Benefits may vary by plan and county. The benefit consultant will take you through the summary of benefits at the end of this presentation. Are you eligible for one of our Medicare Advantage plans? You are if you're enrolled in Medicare Part B and are eligible for Part A and are a permanent resident in the plan's service area. Federal law will not allow us to accept anyone who has end-stage renal disease, kidney failure resulting in kidney dialysis. One of the most frequently asked questions about healthcare coverage is, when can I enroll? Let's go over the 2016 plan year Medicare timeline, which has 4 parts. The first part is called pre-enrollment and runs from October 1st through October 14th. This is the time to compare your options and costs so you can be ready to enroll by October 15th. The second part is the annual election period, which starts October 15th and ends December 7th. At this time, if you are eligible, you can enroll in Medicare health benefits, such as a Medicare Advantage plan, with or without prescription drug coverage. Next comes the annual disenrollment period, which runs from January 1st to February 14th, 2016. During this period, you may disenroll from your Medicare Advantage plan and return to Original Medicare, and you may decide whether you want to enroll in a standalone drug plan. Finally, during the lock-in period, which starts February 15th and ends December 31st, 2016, you can make a plan change only if you have special circumstances. CMS uses the term special election period to define when a Medicare beneficiary is able to enroll or change plans or PDPs because you meet certain requirements determined by CMS. For example, if you move to another service area, or if you qualify for or lose Medicaid eligibility. Let's review today's Medicare environment and the different options you have to receive your Medicare coverage. Your first option is Original Medicare, and you can select whether you want to add a Medicare Part D plan. Since Original Medicare does not offer prescription drug coverage, Some people select a PDP plan, in addition to Original Medicare, to help with their prescription drug costs. Another option is selecting a Medicare supplement plan to help reduce financial liability, since gaps can occur with just Original Medicare. Your other option is choosing a Medicare Advantage plan like Simply Healthcare plans, where you can assign one company to manage your healthcare needs. Now that we've seen an overview of your options, let's take a more detailed look into each one. You might have heard of the term Original Medicare. With Original Medicare, you must continue to pay your Medicare Part B, or it may be covered through your state Medicaid program. Through Original Medicare, you have access to any doctor or provider that accepts Medicare. With this plan, your out-of-pocket costs include hospitals, medical deductibles, and co-insurance. So you may want to purchase a separate Medicare supplement insurance to cover the gaps. Medicare Part A covers hospital care, like inpatient hospital stays and care in a skilled nursing facility. Medicare Part B helps with medical expenses, such as doctor services, lab tests, and other outpatient procedures. There are deductibles and co-insurance with Original Medicare. For Part B, you pay a monthly premium. For 2015, the monthly premium was $104.90 and may change for 2016. Beneficiaries must continue to pay their Medicare Part B premium. Medicare Supplemental Insurance Plans, also called Medigap, fill in the gaps that exist within the traditional Medicare coverage in the form of deductibles and co-insurance. Medicare supplemental insurance plans are designed to help pay some of the hospital and medical costs not covered by Original Medicare Parts A and B. The other alternative is a Medicare Advantage plan, which is the type of plan Simply Healthcare offers. What does a Medicare Advantage plan do for you? First, they must offer all the benefits of Original Medicare and can include Part D prescription drug coverage. Here's how they work. Under this option, Medicare pays Simply Healthcare plans every month for your care. The advantage for you may be more savings, since most Medicare Advantage plans have lower out-of-pocket costs than Original Medicare. Here are other important ways a Medicare Advantage plan can be beneficial to you. 1. Most Medicare Advantage plans offer health and drug coverage, as well as extra benefits. 2. You don't need a Medicare supplement. And 3. There is very little paperwork and less ID cards to handle in order to receive care. However, with these plans, you may have to use certain healthcare providers. Now, let's go over how a health maintenance organization, or HMO, works so you can see if it's right for you. An HMO has a defined network of healthcare providers. With an HMO, you are under the care of a primary care physician who coordinates all your medical needs. With an HMO, you may have to receive a referral from your primary care physician to see a specialist, and you must use all network providers for all scheduled care. There is no coverage for out-of-network care except for emergency or urgent care. However, with an HMO, your out-of-pocket costs may be significantly lower. We have talked about a network of providers, and you may be asking yourself, is there a guarantee that your provider is in or will remain part of a plan network? Like Medicare, Simply Healthcare plans cannot guarantee that your provider is in or will remain part of a plan network. However, here are some ways you can determine if your provider accepts your Simply Healthcare plan. It's very easy. Go to mysimplymedicare.com. Use the Simply Healthcare plans, find a provider or pharmacy link, and find your physician, specialist, or pharmacy. You may also review the provider directory with your benefit consultant, or you can also call our Member Services Department for more information. Medicare prescription drug plans, also known as PDPs, have a premium. These premiums will vary by company. You also must ensure that your Part D plan offers creditable coverage. With a Medicare Advantage plan like Simply Healthcare, you receive prescription coverage and do not need to purchase a prescription drug plan. All prescription drug coverage plans, also known as Part D, are required by law to offer benefits equal to or better than basic Medicare coverage. This chart represents what CMS calls its standard drug benefit. In order for CMS to approve a drug plan, It has to be at least this good to be considered creditable coverage. In its simplest form, the chart is telling you that if you select a standalone PDP or even a Medicare Advantage plan with drug coverage, you have the confidence of knowing that the drug benefit in your plan is at least as good as the Medicare benchmark. Chances are you've heard of the Medicare prescription drug coverage gap, also called the donut hole. The coverage gap is the period where you have to pay part of your drug costs before additional Medicare coverage kicks in. The benefit consultant will review the coverage gap in more detail when he or she takes you through the summary of benefits at the end of this presentation. An important consideration when selecting a prescription drug plan is the list of drugs covered by the plan, also called the formulary. The Simply Medicare Advantage formulary covers all of the drug classes required by Medicare, although that does not mean that they cover every single medication. By logging on to our website, you can look up the most updated list of covered drugs. Participating pharmacies are also a key factor. Make sure that the pharmacies you want to use will accept your PDP coverage. Simply Healthcare Plans has a pharmacy network of hundreds of pharmacies, including Publix, Navarro, Walmart, CVS, Walgreens, and many more. Now that you have learned about Simply Healthcare, let's choose the plan that best fits your needs. The questions you want to ask yourself are: what coverage do you have now? What do you enjoy about your current coverage? What would you like to alter from your current coverage? Do you make your own healthcare decisions? Let me summarize what you have told me. At Simply Healthcare Plans, we have a variety of plans to choose from for people with different needs, such as Simply More, Simply Extra, Simply Complete, Simply Level, Simply Care, Simply Comfort. The benefit consultant will go over the plan that best fits your healthcare needs based on the needs analysis reviewed earlier. You may also be eligible to receive extra help in paying your prescription drug premiums and costs. To see if you qualify, you may call any of these numbers. There are many public and private programs available that can help with expenses. The government has recently changed the eligibility criteria, allowing more people to be eligible for help. Each program has specific eligibility requirements determined by the applicable agency and not Simply Healthcare Plans. The numbers shown here may change throughout the year. For the most updated chart, please contact the Department of Children and Families. You have now learned about our Simply Healthcare Plans designed with you in mind. If you've decided that one is right for you, here's what happens next. After you complete an application, you will receive a verification call from Simply Healthcare Plans, followed by your ID card, evidence of coverage, and a prescription drug guide. You will also complete a health assessment to see if you qualify for special health programs. You can then begin to take full advantage of your plan and all the extras it provides on your effective date of coverage. You may also contact Simply Healthcare Plans or your Simply Benefit Consultant at any time. If you're interested in joining Simply, have any questions, or would like to know more about your options, there is more information available to you. You can look at your Medicare and You 2015 handbook or call Medicare at the number on your screen. Or you can call your local Shine office. We hope to have provided you with the information you need to make an informed decision in selecting the Simply plan that fits your individual needs. Here's the number to call for more information about Simply Health Plans and benefits. Thank you for your time and attention.